92Q, good morning. Go ahead and ask the expert.
Hello.
Hi.
My question is there a healthy alternative or something else that can be taken besides taking metformin?
That's a great question as well. So we usually lean towards metformin for a bunch of different reasons. Number one is a lot of the medications that we use to treat diabetes have that side effect of what that first caller talked about of hypoglycemia. Metformin does not have that at all. And so it also, prior to the newer drugs, and I'm sure we'll talk about some of these newer drugs like Ozempic and everything like that, but prior to that, it did have the benefit of having a lot of weight loss. Now, that being said, alternatives to metformin, we're starting to see newer drugs on the market, such as Ozempic, such as Farxiga, those medications that you see commercials for. But most insurance companies will not cover those until you try metformin and say, hey, metformin wasn't for me. It didn't work properly for me, or it didn't get the intended effect that it got. So, for us, we make choices based on evidence and based on safety. Safety is my first priority. If you have kidney problems, I'm not going to give you metformin because metformin has to be eliminated through the kidney. And so, I have some people that come in already having kidney problems that can't take metformin. And so there are other drugs that we use, like those newer drugs. But again, we have to then think about the low blood sugar, the hypoglycemia, or the medications like Farxiga. If you have urinary tract infections, those medications cause you to pee out sugar. And bacteria and funguses love sugar more than anything. So, if you have urinary tract infections, it's going to increase those. So you got to be careful. That's why you got to go to somebody with some training, not just some WebMD training, but an actual Meharry degree, spend some time in a classroom.
So that means go see Dr. Smith.
Come see
Come
him.
on, holler at him.
Come see you then.
You go see him.
I'm at Meharry Medical College. I'm in the National General Internal Medicine Clinic. Can I give some numbers?
Please.
All right. So the MMG appointment line, 615-327-6348. The Skyline Clinic, 615-860-7511. Nashville General, 615-341-4397. That's where you'll find me. And then finally, the Total Health and Dental Clinic is in Antioch, 615-963-2800. It's right next to the Kingdom Academy, route to my brother LaSalle, who is there working now.
What's up, Sal?
Hey, LaSalle. Thank you for your call.
Thank you.
Thank you so
Appreciate you.
Now, metformin makes Tino poop.
It does. Yep. Hey, you own it.
She on it. That's the wife.
It makes,
On his butt.
Yeah.
So like if he eats a lot or does something, he's like take half a metformin or something. Is that safe?
That's the major side effect that we know about. So what I educate my residents and students on is to tell your patients to anticipate that. Right now, it's not ordinary for it to continue past like 2 to 3 months. Okay, so when you start any new medication, it has to acclimate itself to your body, right? So after 2 to 3 months, if you take it regularly, that should decrease, if not go away completely. If it doesn't, there are versions of metformin, like the extended release metformin, that have less of that side effect. But we know that happens. The best thing to do is to say, hey, you're going to have some loose stools for a little bit, but your blood sugar is definitely going to decrease. And so 6 in one hand, half a dozen in the other.
Let me see what I'm trying to find Jarrell's question now. Can someone diagnosed with an A1C of 6.4 choose a diet and exercise in order to lower it first, or should they start taking metformin?
So that's controversial. The current guidelines advise to start metformin, but for a lot of my patients, I go ahead and give them a trial of diet and exercise. But I'm realistic about what that actually means, because a lot of times we say diet and exercise. What does that mean, right?
Right.
So sustainable change to your diet, avoiding white foods like we were talking about earlier, avoiding the rice, mashed potatoes, mac and cheese, all those great things I love to go get in sweats and places like that, right? Because they taste so good. But they are stores of sugar. They're starches, and they break down directly into sugars. So you got to avoid those things. And then when we talk about exercise, what we mean is 30 minutes of getting your heart rate up continuously. So a continuous 30 minutes of exercise 5 days out of the week. That's a lot.
That's Sean. Sean do that.
Shout out to Sean. I mean, and he looked
2
like
hours.
it.
He looked like
Sean fit. You know what I mean? And so, and to that point, there are a lot of people that exercise that don't necessarily look fit, but are doing the right thing. So if we were to take a microscope into there and look inside of their bodies, the fat around their hearts would be low. You know what I mean? So they might have that outward appearance of having, some look that is stereotypical, but they are healthy underneath. Now, I do want to make one other point real quick about like the way we look, because for men especially, that dad bod that they talk about, that big protuberant belly.
Yeah.
That is one of the big signs for us as a doctor that this person may be at risk of having a metabolic disorder, particularly diabetes. Okay. So like if you have that beer belly, that's something to be careful about and to try to work on, try to make sustainable changes.
So if you said 7%. So let's say you're at, you have set the 7%, you're taking the metformin and you're eating right and doing everything, and your A1C level goes down. Do you continue to take metformin if you're below that 7%?
I have considered, if people can maintain that, I have considered taking them off the medications. Now, sometimes you have to consider that the medication is what's keeping them there, right? So I have to weigh those things. But with that being said, like if I have a patient that for 2 years has been below 7 and is approaching like 5, yeah, we'll give them a trial to take it off. We'll give them a trial to take it off off of their profile.
Monitor it and make
sure.
And
we'll see. And some people are able to make those changes and make those changes sustainable so that they don't need to be on medications. But I'm here to tell you, if you need to be on medications, stay on medications. Those medications are doing something for you. You know what I mean? And far, like I don't get paid by any drug company. I'm put that out there because we have to make disclosures, right? No drug company pays me anything. My money is strictly from Meharry Medical College, and that's teaching and taking care of patients. None of that has to do with what I prescribe, anything like that. I don't have any preferences for one drug over another, other than what I read and what I know. And I got paid and I got training to read and understand things at a high level, right? So all I ask is like what I think it was Jay that said, all we ask is trust. You know what I mean? All I ask is that you trust that I know what I'm doing. And, if I'm not everybody's cup of tea for sure, but I got some colleagues that might be your cup of tea.
Right.
I'm not the only doctor in Nashville. I would love to see everybody, but see somebody, see a primary care doctor.
So we're going to
in here with the good doctor this morning with Meharry Medical College. And listen, man, we're noticing that a lot of the ladies are calling up here.
Yeah.
And it's Men's Health Month.
They calling for their men.
It sounds a lot like my clinic, right?
Yeah.
It's more ladies. And to your point, Sissy, the women come in for their husbands. They advocate for their husbands. My male patients who have wives do better. So this is my shout out. They're stubborn. You're right. But this is my shout out to the guys who don't fit those categories. If you're listening out here, you don't have a primary care doctor. You've been scared of the doctor. Nothing to be scared of. If you have a disease, it's there. Whether you know it's there or not, you might as well deal with it. I sound like the Everest College commercial.
Wow.
Be like, you might as well. You ain't doing nothing else, right?
Come on in.
So, but to the brothers out here, get you a primary care doctor. Get checked up. Most of the time, there's nothing going on, and that's great. And then we don't have to see you, but once every year or so. And just check in, look at those numbers. It's like you would take your car to get a tune-up, right? If you out here, you driving a nice vehicle, you're going to take your car to get your oil change. Why wouldn't you take your body to get the oil change?
That's right.
You know what I mean? Come holler at a doctor. Come see somebody, I know it's loopholes you got to jump through. You got to wait a long time to see the doctor. You got to see about 4 or 5 people before you see the doctor.
Right.
And those are the opportunity
frustration
costs, right?
Yeah.
That's that, and I feel that frustration because I too am a patient. You know what I mean? Like I'm not just a doctor; I'm a patient. I'm a bad patient to that point.
Wow.
Oh, I can imagine.
But I feel those pains. Nonetheless, it's not going to stop what's going on with your body. And so, are you going to let those things cause you to have an early death, or are you going to actually come in to see a doctor? I advocate very strongly: come in and see a doctor, guys. If you're a man, you haven't been to the doctor in 5 years, make that appointment today.
Please. I got one question before you go. What are your quick thoughts on Ozempic?
My quick thoughts on Ozempic is so far appearing to be a very good drug to use, especially for weight loss. Now, it does bring the blood sugars down too. It has a fantastic amount of weight loss. Most of that weight loss comes from just decreasing the appetite. People aren't hungry anymore because it slows down all that bowel transit and it becomes uncomfortable for you to eat a lot. That's what it really does. It makes it uncomfortable for you to eat a lot. Though that being said, those drugs tend to work pretty well, except for if you had some thyroid problems or if you've had a lot of pancreatic problems like pancreatitis. So if you've had those things happen, you need to check with your doctor first before asking for those medications. But yeah, I try to prescribe them. The problem is that a lot of the Lululemon chicks out there are getting it, and my diabetics can't.
See?
You know what I mean?
Now, here they are
Right,
sick and need the
right.
medicine, and you out here trying to lose weight.
But isn't it,
What is a Lululemon? I need to know exactly the definition before I start to use it because
So
I like
when
that.
Kenny first jumped on and he started talking about a certain, bad, I'm not gonna say what he
yeah.
said.
Butch
But
body.
her-
Okay.
those young ladies.
Oh, okay.
All right.
yeah,
There you go.
Alright.
but we got to make sure we understand this. Even though people are on Ozempic and it's a medically prescribed drug, the importance of still being active and working out is still important in this situation.
There is no substitute for changing your diet and for exercising.
Wow, look at that.
No substitute.
No substitute for that.
None.
These drugs will cause you to lose some weight, but as soon as you get off that drug, guess what's gonna happen? Boom,
You'll
it's
gain
gonna
it right
rebound,
back.
and it might be even more.
All right, guys.
615-341-4397. That is where Dr. Smith is.
That's
And
right.
he has three other locations, MMG, Skyline, and Total Health and Dental Clinic.
That's right. That's right.
All right, guys, and on YouTube right now, we're going to be on YouTube until 8 o'clock. So if you were calling in and you still want to try to get that done, hit us up on YouTube right now at 92Q Nashville. Give a round of applause for the good doctor, Dr. Smith.
Thank you so much.
Thank you. Asking the expert. Ask the expert.
Hey, good morning.
Good morning,
I want
sir.
to talk to him how he was talking about the Ozempic. My primary care doctor has me on it because I was classified a type 2 diabetic, and it has brought my A1C from a 6.9 down to a 6. It works great. But he also told me I haven't experienced the weight loss yet. I've only been on it about 3 months. But he did tell me when you start losing weight, like you and Sean said, he said keep your exercising up because half of that weight you're losing muscle as well as fat, and to watch your diet. So I was just wondering, has the doctor heard anything about the weight loss part of it? My doctor's telling me you will lose muscle mass as well as fat.
Yep, that's true. That's true. That is
Okay.
true. And I've seen most of my patients that are on these medications do lose weight almost immediately. So I'm surprised to hear that you hadn't really lost the weight. But like to your point, the main reason why these drugs are on the market is the A1C. So congratulations to you. You should be commended getting it down to
man,
6.0.
come on now.
Yeah,
All
man.
right, brother.
You're killing it. You got a good doctor, it sounds like. So
Yeah, he's a great doctor.
yeah. So I would tell you to continue to, the medication is working. It's doing what it's supposed to do. But to your point that you made, you got to continue to make those other sustainable changes because ideally, I mean, it's a shot with Ozempic, right? People don't know that. It's a shot, a once weekly shot. And so, some people are scared of
What?
shots. Right. Exactly. Some
Took mine this morning.
yeah,
No one told me that. I thought it was a pill.
Yeah,
No,
right.
it's a shot, little butterfly needle.
So, if you're scared of shots, that's an incentive
And
right
you do
there.
it yourself?
You do it yourself.
I do mine in my stomach.
Yeah, I know a couple people that I mean, I have been known to take a phone call and encourage a person or two to go ahead and take
do
that
it.
shot. Yeah, but it's, like if you are scared of needles and all those kind of things, like if you have poorly controlled diabetes, you're going to have a lot of needles in your life. So, if you need some incentive to stay away from that sugar, having needles for the rest of your life, insulin, blood sugar checks, you know what I mean? Like that's not fun. It's not, it's an inconvenience to your lifestyle. It's an inconvenience to your lifestyle. So why not hit it on the front end?
There you go.
All right, bro.
Thank you.
Good luck on your journey, man.
Good
Keep
luck.
it getting down. Then when you call back, it's going to be 5.
Hey.
Oh, yeah.